there, my name is Lori Haichu and I am an RN at Student Health Services. And what has working at Student Health Services meant to me during the pandemic?
It takes too many words to describe what these past 2 years have meant to me.
Not gonna lie, it's been pretty stressful.
Well, it's definitely been an emotional roller coaster.
Without a doubt, the last 2 years have been the most challenging of my 25 plus years as a registered nurse.
My emotions initially started off as guilt. We would get people walking by as I sat at a screening desk thanking me for being a nurse, and friends, family also thanking me, yet I wasn't really being a nurse. I felt like I wasn't doing enough for our community or for our campus.
The pandemic was feelings of not being enough.
Initially, I felt unworthy to be called a nurse because nurses were getting a lot of attention on being heroes, and I felt like I wasn't contributing.
Not on the front lines and not being the nurse that you kind of felt that you should be.
What we didn't know was huge, and what we knew was very small. And as a nurse, it's a very uncomfortable feeling to have people asking you for help, and you're trying to help and you're not sure what you're telling them is the right thing. And this was a very serious situation. In those early days, I just remember them being very fraught.
Every time I came in, there was a new change. Everything was constantly pivoting.
Thank goodness those feelings were short-lived because in the coming months after the pandemic started, we actually opened our own COVID assessment center. So that was amazing, gave us some hope. But in saying that, it also created some anxiety because we had to learn some new skills. We together had to assess very sick people, and there was some anxiety there too, even though we were wearing gowns and shields and masks. We still didn't know a lot about this virus, and our own mortality would be what would happen if we got it ourselves and took it home to our family.
I was scared, but what a privilege that has been, and the teamwork that, I could not have done what I've done in the past 2 years without this team of nurses, doctors, admin, and, of course, our manager, public health, numerous people that all came together for the betterment of our students.
With the students coming back this year, it really opened my eyes as to how important that piece is to me as a nurse. That connection, that caring connection, being able to not do incredibly heroic things, but just those little day-to-day connections with them, let them know we want what's best for them and we're there to help them on their journey.
And I'm looking forward to working with students and seeing their faces again.
We're still in it, but we're getting closer, and just a privilege and an honor to help the students, to be there for the students, and to ease their minds, their souls.
We can look back and we can say that it's made us stronger. And for me too, at this point in my career, I enjoy coming to work every day, and I love our students.
It's an honor. It's been an honor after being a nurse for 37 years to feel like I was able to contribute and have an impact and really help in this latest health crisis.
We are a lot stronger than we thought we were, and we really can tackle anything. And I'm so very, very, very fortunate to be a nurse working with such a great team at University of Guelph Student Health Services.
Happy Nurses Week.